mercies are made new every day. On this day, help us to do what is right and asked of us by our authorities. Give us a spirit of compassion to love and forgive others, including ourselves. And let us serve and support one another as you do for us. I ask your blessing and peace be over us all. Amen.
Amen. Thank you, Chaplain. And again, we appreciate you coming. We've gotten a lot of questions about a lot of different things, and this is one forum in which we try to answer a lot of questions for people. At the same time, we're making great progress, as you know, and we'll have some different speakers answering questions as well in sequence. But let me say this, people are asking about drastic orders, shelter in place, and distinguishing essential from non-essential businesses and all those sorts of things. We will do that if and only if it becomes necessary to take those steps. When will it become necessary? How will we know? We will know based on the data, on the facts, on the science, on the expert knowledge and opinions and analysis of the professionals in the fields, representatives whom you see standing here in front of you today. And we'll do it on the basis of nothing else. If that time comes, you will certainly know, and we will say so. I have great faith in the people of South Carolina. They follow rules, they're respectful, they're courteous, they're gentle, they're smart, they're resilient. And if you will notice, the things that we have asked them to do, they are doing, and they're doing very well. We directed state government to cut back. The numbers are this. Those in state government that are working from home or are on leave are 20,918 people. That's compared to the 17,867 of the state employees who have come to the office or their regular workstation. So over half of the state employees in our state are working from home, distance locations, just as we asked for them to, and that maintains that social distance at the office. Colleges, technical colleges, and universities, we asked them to do the same thing. What have they done? Working from home or other distances are 30,544 employees of our colleges, technical colleges, and universities. 4,715 are working from their regular stations at the office or on the campus. That's 87%, over 30,000 working at a distance from home, staying home, and 13%, almost 5,000, are coming back into the office because that's the only place from which they can do that work. That is a great compliance with what is a very common sense rule which we asked them to do. We have closed the schools, we've closed the restaurants and bars because people congregate there except for the takeout service. And the takeout service and pickup is going very well. We've dispersed crowds. I've issued instructions and requests for doing that. And if you drive down our interstate highways, you will see, I think it is 77 of those electronic signs that are saying what? They're saying stay home. And we've been doing that now for over a week or maybe almost 2 weeks. And the good news is people are doing that. They are staying home. They're keeping that social distance, and we're making great progress. So I say again, I have great faith in the people of our state. There are about half as many cars on the interstate highways as usual. You can look at the streets, you see videos, you see pictures on the news. The streets are clear, the beaches are clear, the people are not congregating there anymore, and things are, the rules, the instructions, the advice of the experts based on facts and science are being implemented mostly in a voluntary fashion here in South Carolina. So I say again, I've got great faith in the common sense, the wisdom, the resilience, and the commitment of the people of our state. And with more information, here's Dr. Bell.
Thank you, Governor. Good afternoon. As of today, South Carolina has confirmed cases of COVID-19 in 39 counties across the state. All updates will be posted on our website for county-level counts. It is with great sadness that I also report that we have lost 2 more fellow South Carolinians who were previously confirmed to have COVID-19 infection. This brings the state's total number of deaths to 9. Our condolences go out to the family and friends of these individuals and to all those in South Carolina who have lost loved ones to COVID-19. Please let us remember to take necessary actions to protect ourselves, our families, and our community from this disease. To date, we have reported receiving 456 confirmed cases from our public health lab and from private laboratories, and our public health lab has performed 2,578 tests. The variation in the number of new cases from day to day reflects the availability of chemicals, also referred to as reagents, needed for laboratories to perform this testing. There is a shortage of these chemicals nationwide and within South Carolina, including the DHEC Public Health Lab, which can lead to delays in the results of tests being made available. This means that on a given day, the number of new cases reported could be much higher than it would typically have been if it includes results from tests that were delayed from a previous day. Because of potential shortages, we do not recommend that everybody who is ill get a test to see if they have COVID-19 infection. If disease activity increases significantly, we will advise people to stay home, get better, and seek medical attention only if symptoms are worsening. This will allow our healthcare systems and our healthcare providers to give care to those who are most seriously ill and need it most. As I stated previously, our country is now in the initiation phase of the pandemic, and states in which community spread is occurring are considered to be in the acceleration phase, and this includes South Carolina. It's important for South Carolinians to understand that spread is occurring, and we will continue to see more cases of COVID-19 in our state. With the increase in cases being reported, we are now able to propose projections for the number of new cases that we expect to see in our state. Based on the information that we have today, we project an estimate of 2,657 cumulative cases by April the 2nd and about 8,000 cases by May the 2nd. It's important to remember that cumulative cases also include all previous cases, and not all are still infectious. This data only provides predictions and may change significantly over time due to various factors. Predictions are helpful in providing information to help communities with the information needed to plan for health care and other critical needs. Regardless of these predictions, individuals should continue to follow recommendations to protect themselves and prevent the spread of COVID-19. As the number of cases in our communities continues to grow significantly, we must get better at our approach to controlling the spread of the disease. This includes taking seriously the recommendations to practice social distancing, stay home, and away from other people when sick, and wash your hands frequently with soap and water and observe regular hygienic practices. We've now moved from disease containment to a disease mitigation strategy. In the mitigation phase, testing strategies focus more on testing a reasonable sample of those who are ill in a community rather than attempting to test and identify every single case. This means our investigations will change from attempting to find the close contacts of each individual case to prioritizing investigations of those who are at higher risk of exposure or higher risk of severe illness. People should not expect individual notifications that they were exposed to a case or that they were in a community setting where a case has been. I can't stress strongly enough the importance of all of us practicing social distancing, staying home and away from other people when sick, and washing our hands often, regardless of if cases have been reported in your immediate community. People with signs of illness must stay at home and avoid public gatherings. Stopping the spread of this disease will not be easy, and many of us have already made many sacrifices. As the virus spreads, we could be called on to make even more sacrifices. This is a serious time that calls for serious action, and our chance of getting the best outcome hinges on all of us doing our part. There has been some reporting comparing COVID-19 to other diseases like tuberculosis. And I want to be clear how different diseases are spread is particularly important in how we make decisions about how to prevent spread and how to prevent exposures and how we define who is at risk. And these two diseases are simply not comparable. Tuberculosis is caused by a bacteria. It has a long incubation period and a slow developing course over the course of years prior to the development of active disease. We get fewer than 100 active cases of tuberculosis in an entire year. And we do worksite investigations for tuberculosis cases because individuals who spend a lot of time together in the same space over a prolonged period of time are at higher risk. This is not the case for COVID-19, which is caused by a virus, has a very short incubation period, and a finite course of illness. So those who are working in an environment or who have brief casual contacts with COVID-19 cases don't require the same notifications that we do when we identify a tuberculosis case in a work site, just to make one comparison. So it must be kept in mind when attempting to make comparisons about these two diseases, how they're spread and how we define those at risk, because they're not comparable. I would like to express my gratitude to our public health professionals, medical workers, and first responders who continue to work tirelessly to protect us all as we face this new disease together. And for the latest information, please visit our webpage at scdhac.gov/COVID-19. Thank you.
Thank you.
Hi, good afternoon. Nick Davidson, the Public Health Director at DHEC. An important role that DHEC plays in an event like this is to coordinate with the hospitals. We have a wonderful relationship with the hospitals and the South Carolina Hospital Association. And I did want to take a moment to acknowledge the great job that the hospitals and other medical facilities around the state are doing to adhere to what the governor asked, and that is to ensure the maximum bed availability around the state. I'm happy to report that, particularly because of the freeing up of elective and canceling of elective procedures around the state, that the hospitals have made additional beds available. And as of this morning, the beds utilized around the state were 6,863 beds. The beds available, 5,528 beds. And so that's a utilization rate of 55%. And that number has been increasing since Monday. That number is up in and of itself 10%, the number of available beds since Monday. And so we appreciate the work that the hospitals are doing, that the Hospital Association is doing, and frankly all the medical providers around the state to make resources available. Ventilators are another thing that folks are asking about for those that are hospitalized. In a survey just earlier this week of hospitals, there's a total of 1,260 ventilators in the state total. Of the facilities surveyed, which is the majority of the facilities, there were only 180 of those in use. So you can do the math, but that's a significant balance that remains of available ventilators around the state. We're also working with our partners here at the state and our federal partners to request additional ventilators. And so we put in an additional request for just greater than 130 additional ventilators in case we need them. So again, our thanks to the hospitals for their compliance with the governor's request, as well as for the great working relationship with us here at DHEC. Thank you. Thank you, Governor.
Yes, sir.
Good afternoon. Jamie Suber, Chief Administrative Officer, Department of Employment and Workforce. Thank you for this opportunity, Governor. I'd like to share information, and I know most of you have received information associated with the initial claims for week ending March 21st. And obviously, these are unprecedented and record numbers of initial claims coming into the unemployment insurance program. We were over 31,000 on last week in regards to new claims coming into the system, which is close to a 1,600% increase. For the week prior, we were close to a little under 2,000 claims. So as you can imagine, we went from 2,000 initial claims up to 31,000. So we have received a great deal of inquiries in regards to the volume, the number of calls that we're taking through our dedicated contact center. And we want to stand committed to let you know that the Department of Employment and Workforce are following the executive orders and doing all that we can to expedite the claim filing process and make this process seamless for those that are truly in need and looking for some type of relief during this temporary period of time, we hope. But we do not know what this looks like, and we're doing the best we can to project and forecast the impact on what we see now as a solvent trust fund and understanding what that impact's going to be as we continue to provide services to those that are in need. A lot of individuals have reached out to us in regards to what are we doing differently to try to adjust to these high volumes of call and high volumes of claim filing. We're looking at strategies on a daily basis. We're moving employees across the agency to better support our call center. We're looking at additional hours that we may use. We're looking at external entities that may be able to help us navigate customer inquiries. And we're making real-time updates and changes to our website to provide additional information that will keep individuals from having to contact us. We're making real-time updates that are including frequently asked questions, and we're providing resources directly for both job seekers, claimants, and employers. One of the recommendations that we're working with employers through the governor's office is a process known as employer file claims. It's a process where the employers are filing on behalf of those individuals through this temporary layoff situation, where we hope to be able to speed up that process and allow individuals to get benefits more timely. So these are some of the things that the employment and workforce are doing. We want to stand and let you know that our employees understand the magnitude and the severity of the services that we provide during these trying times, and we stand on the ready to continue to support this great state. Thank you, Governor.
Thanks, sir. Commerce. Thank you, ma'am.
Good afternoon. My name is Jennifer Fletcher. I'm the Deputy Secretary at the South Carolina Department of Commerce. And while we are hearing about these record unemployment numbers, I want to tell you today that business in South Carolina is resilient and they are operating. We have been in touch with about 85 companies who are stepping forward to look at if they can transition their processes into making some of the goods that are needed throughout the state and throughout the country. For example, Composite Industries in Rock Hill is transitioning to make face masks. Humimic is another company that is transitioning to make the face shields. So our businesses are resilient and they are employing our folks and they are continuing to work. The Department of Commerce and a network of business agencies, many of whom you've heard from at these press conferences, and a number of other business organizations are focused on helping our businesses stay in operation. And so on Commerce's website, that's sccommerce.com, we have links to a number of different resources that businesses can utilize to keep informed and to make sure they stay operating. Also, our group, this collective business group, we're also providing resources to companies. For example, if a company does want to transition and make a new product, we can put them in touch with consultants that can help them make that transition. If they're having trouble with their supply chain, or because of a transition into making one of these products need some new inputs into that, our team can help do that as well. This is not Commerce alone, it is a collective group, but Commerce can be the clearinghouse for that. And on our website, in addition to the resources, you'll find email address. You can simply send us an email there and we will get you in touch with the right person just as quickly as we can. With that, I just want to close and thank all of our businesses. You are the lifeblood of the state. We appreciate all you're doing to transition in this time, and also for all your team members who continue to show up every day for work. So thank you.
Thank you, Ms. Fletcher. And as mentioned, all of these agencies have websites, and I think all of them had been reworked and added to dramatically in order to specifically address the COVID virus. So you can go online and get a whole lot of information very easily. Are there any questions?
Yes.
Yes.
Now, you said you're not going to do a statewide order right now, but as you know, Columbia just passed one and Charleston's went into effect today. What do you think of cities doing this on their own?
Well, I haven't read all of those and I don't know of all the details, but from what I have read and seen, most of the things that are being ordered or being done are things that I've already, and we in this group have already called for 2 weeks now, and mostly on a voluntary basis. So the good news is the South Carolinians are following these instructions and following these requests and suggestions very well.
So just to follow up, restaurant owners that do take out orders, they can continue to go on even after the stay-at-home ordinance take effect come Sunday?
I have not read those things, but that is that order is an executive order of the governor, and that stays in place.
Governor McMaster, the president has said he wants the country back up and running by Easter.
That's good. We'd love to be back in business by Easter fully.
You've closed schools through the end of April. We've seen these local jurisdictions try to put these stay-at-home orders in place. Do you think that the president's misleading any citizens, or is there mixed messaging going on?
No, I don't. The president is optimistic. The president realizes, as Ms. Fletcher of Commerce just said, that business is our lifeblood. The business of South Carolina is business. We recognize that there are some businesses, particularly smaller businesses, that if they shut down, no matter what aid comes later, they can't wait that long. They can't hold their breath that long. And so we're trying to do everything we can do to keep business flourishing and keep businesses growing without putting the public health in jeopardy. That is the reason why that we listen to and count on the expertise, analysis, and knowledge of science, data, facts, and the professionals who make these kinds of understandings and recommendations for a living. That is who we are listening to and working with vigorously around the clock at the state level.
So, Governor, along that line, the president did send out a letter to governors today asking that he's working to classify counties as high risk, medium risk, low risk. We heard from health officials the other day at that podium say that we shouldn't be looking at numbers in individual counties. We should be assuming that the virus is everywhere. So what do you say to the president who says we should classify counties based on high to low risk?
Well, I understand what we were on most of the governors were on the phone with the president and the vice president this morning. That may be the conversation you're talking about. And certainly there's some places that are more dense than others. And New York City is much more dense than places in South Carolina. So the same rules and same projections don't apply everywhere. But the best rule, as you've heard from Dr. Bell and Dr. Toomey and everyone else from DHEC since the very beginning, is you have to be very careful and presume that you have the virus and may be transmitting it to another if you're not careful, and that they have the virus and may be transmitting it to you if they are not careful and you're not careful. That is the best way to do it, and I'm convinced that that is what most of the people in South Carolina are doing. They're following those instructions.
Governor, would your orders make local rules moot? Would your orders override local rules?
That's a good legal question, but that depends on the rule. It depends on the executive order. It depends where there may be conflicts here and there. In those cases, it's the executive orders of the governor that are paramount. Yes, ma'am.
I have a question for Dr. Bell. So you mentioned the shortage of chemicals right now. How many pending tests do we have, and how long on average is it taking for a test to come back for someone?
In the state public health lab, we have a backlog of approximately 1,600 samples that are waiting to be tested. There are also delays in the private labs, and some of the private labs are reporting a delay in getting test results back from 7 to 8 or sometimes even longer.
While you're up there.
Yes, sir, in the back.
Now that you have projections, do they get worse tending to those numbers, or does it get?
Could you speak up just a little bit?
Now that you have projections, do the projections get worse for the people with the coronavirus, or are they changing or anything like that?
Well, the projections that we are tracking out to about the end of May, the slope of that curve has been looked at over the course of a week or so, and it for the model that we are currently using, there are a number of models, but it appears to be about the same. As we get more case reports, That will give us more information about the steepness of the curve, and over time we can see if that curve is flattening out and whether these social distancing measures are working here and in other places.
Ms. Adcox.
You've said that the hospitalization numbers that you gave yesterday's demographic numbers are just hospitalizations at time of illness. Why not track hospitalizations on a daily basis?
Well, we're not giving hospitalizations. Those are numbers of cases reported.
Okay, so why not track how many people are in the hospital and leave the hospital and that sort of thing?
Well, we conduct disease surveillance for cases reported, for positive cases. That's what by law is required to be reported to us. Once they're in a healthcare setting, our disease surveillance activities to detect new cases, we don't follow people. The health department does not follow individuals throughout their hospital course and maintain a database to see when someone has been discharged and for what condition. So they may be kept in a healthcare facility for a number of reasons, but we do disease surveillance and we report positive test results.
Questions?
Hi, Governor.
Yes, sir.
What are you thinking about the primary in June? I mean, do you think that it's going to need to be moved? Do you think there's going to need to be changes made?
At this point, those primaries they're set by law. The legislature would have to change that date. At this time, I see no reason to upset that system.
And also, Governor, you said that you weren't sure about the legality if a place like Charleston or Columbia issues an order that goes further than your orders on stay-at-home or something like that. Do you think it's wise for a city to put in more strict restrictions than you put in place for South Carolina?
I think it's wise for the cities to be thinking and to determine best practices for their area. Every area is not the same, as the President has noted in the earlier question, but it's clear that the state law is paramount over a local law. Same thing goes for an ordinance. But we're urging people the South Carolinians have demonstrated if you tell them what to do and why to do it, that they'll do it. And it's for that reason that we're having what we think is success in the voluntary compliance with the suggestions, recommendations that are made not by anybody other than the trained professionals that do this for a living, health and science and data. Every decision that we made starts with health, science, data, the advice and insight of the professionals who work with it, who are trained for it and give us their best advice and analysis. That's how we make our decisions in this office. I don't know how everybody else makes theirs, but I know we have excellent advice and excellent experience and know-how represented in these agencies.
Governor,
Yes, ma'am.
you tweeted that tourists should basically self-quarantine if they come into this
Yes,
state.
ma'am.
How do you enforce that, and do you think that will be part of a future order?
It may be. That's a question, because we have a lot of people coming to the state from out of state, and the Myrtle Beach area is experiencing that. Some other places on the coast. Those are good questions, and we're attempting to answer those based on the science and the data. Some of the local jurisdictions have some ideas and have made some recommendations and taken steps. And we are analyzing all that to make the right decision.
Mr. Davidson.
Yes, ma'am.
You've talked about getting advice from individuals and organizations to make these decisions. Can you elaborate a little bit on who or what organizations?
Sure. Mayors, legislators, doctors, lawyers, business leaders, retired people, young people. We are flooded with advice, information from everywhere, and everyone up here that you see and their colleagues are likewise flooded. So we're getting plenty of information, and it's important that we know what exactly is going on and what the people are seeing and what they're doing. But we like to have information. We can't always respond immediately to answer those things, but we ask people to continue letting us know what you think and what you see.
Mr. Davidson, this morning the CEO of the hospital in Orangeburg said hospitals did not receive anything from the national stockpile. Can you add any kind of clarity of how those supplies were distributed and how they were, after they were sent to each county?
Sure. We understand at DHEC as a state agency that we can't possibly best determine exactly where our resources would go. So we're working very closely with our our colleagues here at EMD, and more directly even with those at the state emergency management office, the county emergency management offices. So those county emergency managers received a push from the Strategic National Stockpile, and then we know that best decisions are made locally about where resources are needed and where they're available. And so those county emergency managers and that county it's ultimately their determination as to where the greatest need is based on the resources that they receive.
One more for you. You say we have enough ventilators, but we've heard concerns of a lack thereof. Like, how fast are hospitals able to use them, and is there a turnover issue that
Sure. We're monitoring it very closely. At this point, we don't see anything that seems to indicate that there's any sort of shortage or inadequacy of ventilators, but we maintain that data and we're going to watch it very closely. And as we hear of shortages, we'll work with our colleagues here and in the counties to make sure that they get to the right place that they need to go.
A question for Ms. Fletcher about economic development. Just want to get your thoughts, and maybe you can tell us a little bit about how economic development has been affected by this. You know, looking at companies that are maybe opening new operations here, or companies that are expanding. What's been the situation? Are companies still going forward, or are they kind of waiting to see what happens at this point?
So every company has a different response, you know, during a situation like this. For example, we talked to a company just the other day who was, you know, evaluating their options because they make one of these products that we all need. It was a sanitization device. And so, you know, they've got a different trajectory. Other companies are just trying to keep operations going and the supply going, so their plans might be on hold. The other thing we also have to remember is Asia is getting back to business. And so we, as a state, we have offices in Asia, and we are seeing some activity starting to percolate there. So, you know, I think it's really early to tell the true impact on economic development, but we do have some positive signs.
I have a question about first responders. They continue to tell us that they would like more information beyond zip codes. And I understand that you don't want to give private information for, you know, to give away identities to public, but what about specific locations for more than the zip code for first responders?
Well, we absolutely want to provide any information that's available to protect the public's health. And we also want people to understand the kind of information that we have. So if we report out every case, that doesn't mean every previous positive case. What is needed to make those decisions about protection is who is actually infectious. And so our database doesn't tell us who continues to be infectious. And we want first responders to practice universal standards because there are other people in the community who have not yet been diagnosed. So for EMS systems to do a sort of screening through their dispatchers to try and learn from the callers if they're being called to a residence where somebody is known to be ill with a consistent illness, we feel that that's the best way for first responders to protect themselves against the unknown. And so we are making the data that we have available, but we don't want it to be misinterpreted for what it means and what it does not mean. And additionally, we are following the CDC recommendations for who is at occupational risk of exposure. And there are individuals in certain occupations who are determined to be low risk based on the probability that they will regularly come in contact with somebody who is actually ill.
So who's low risk? I mean, which kind of first responders?
Well, healthcare workers are at highest risk because by occupation they're expected to regularly have face-to-face contact with people who are sick. EMS workers might be in a different category because they transport people who are ill, and then law enforcement officers might be in a lower category. They're actually categorized in a lower category at being of low risk of exposure because based on the types of activities they're expected to routinely perform for their occupation, and the fact that some of these counties may have single-digit numbers of cases, the likelihood that they would actually come in contact with somebody who is infectious is low, and so they are determined to be at low risk of ongoing exposure.
Doctor, as these numbers continue to come in, if it does show that the curve does not flatten, what can South Carolinians expect to see? What type of further restrictions can be imposed afterwards if it shows it's on the increase?
Well, I can talk more about what we expect to see in terms of cases. We expect to see those increase. And the measures for restrictions for social distancing, we understand if we separate people, and we understand that by having prolonged face-to-face contact with individuals who may be ill is what puts people at risk. So both of those things together, monitoring disease occurrence in the community over time and practicing those social distancing measures are what will help us monitor and what will help us understand if we're making a difference. So there's going to be a delay in the shape of the curve. The cases that we're seeing now are people who may have been exposed a week or more ago. People who are hospitalized now are probably cases that were exposed some time ago, took a week or so to get sick, maybe a week or so longer to decline. And so looking at information in points of time does not give us that much information to react to. We have to look at a trajectory and look at a curve to make overall decisions for a community as we respond. And then we learn from what other communities have experienced when they're in the recovery phase. For example, in China, what we're seeing, those cases have come down, and we learn from all of those pieces of information to make community-based interventions.
Dr. Bell, do we know if there have been any test or confirmed cases of coronavirus in state prisons, DJJ, or nursing facilities that are run by the Department of Mental Health?
I'm not aware of any cases in correctional facilities. And so you mentioned, we are aware of cases in nursing home facilities. I believe that was on your list.
But facilities run by Department of Mental Health.
I'm not aware of that, but.
And you've said in the past, you said 80% of the cases won't require hospitalization. For those people who are going to, and they could get better at home, what kind of treatment, when you're at home, what's the treatment you're going to undergo? How do you take care of yourself?
Yes. Well, there is no specific medication to cure the COVID-19 infection, so it's what we call symptomatic care, is relief of symptoms. Medicines to relieve fever, medicines for comfort, rest, plenty of hydration, and so when people are well enough to stay home, really the most important thing is home isolation to prevent other individuals in the household from becoming sick.
I have an unemployment question.
Before that, this lady had her hand up. Then we'll come to you, Sean. Yes,
Governor, if a South Carolina resident decides to leave the state and then come back again at this point, are you asking that they also self-quarantine for 14 days?
Certainly if they went to these places of high incidence, yes.
So only from certain places?
Well, those certain places seem to be growing pretty rapidly. We would urge people, as we say on the 77 signs on the interstate highways that have been blinking on and off for a couple of weeks now, stay home. This is a good time to stay home. Yes, sir.
So we're told that people are trying to file for unemployment and they can't for technical issues. Do we know how many people are not being able to, and how are you fixing those glitches?
All right, and I know we've had accessibility issues just due to the numbers and the unprecedented volume in our system. As far as a specific number, what we've done is individuals that are coming into the system that we know about with the phones, we have a feature on our phone with the callback feature, so those individuals are able to call us back and we'll call them back. They actually can hold their spot in line and we'll get back to them. As far as the system, there's no way for us to track individuals that have been kicked out or have not been able to complete the application. What we've tried to do is point individuals to our website, see if there's any information that may be missing or incomplete, and ask them to try to get back into our application. I know last week there were some accessibility issues. I've not heard of that this week. We've done a better job working directly with our vendors to make sure that we're monitoring the load and how much activity is taking place on the system real time.
All right. Are there any further questions?
Any thoughts on Jack West?
Yes, he was a fine man from a fine family, and I know those of us who knew and loved him are going to miss him. And we hope that we see fewer and fewer of those cases. But our hearts go out to all the people and the families that we've lost. And I can promise you that those of us here are going to do all we can to lose no more. Any more questions? Thank you.